Welcome to Learning Unit number 5, which is on complementary and integrative health. By the end of this unit, you're going to be able to determine what are the primary reasons that individuals use complementary or integrative health approaches. And you're going to be able to summarize how healthcare providers, such as nurses, can help individuals, especially those individuals with living with chronic illnesses, make good decisions regarding integrative health, and which is truly defined as the use of complementary therapies along with mainstream healthcare. So we've used a lot of different terminology in the past. And about 25 years ago, maybe even a little bit more, we started talking about CAM, CAM, which stood for Complementary and Alternative Medicine. And complementary at that point, and today still means in complement to our traditional Western medicine or mainstream healthcare. Alternative were those approaches that were not accepted by mainstream healthcare. We changed the term to complementary and alternative therapies, CAT, and the most recent use of terminologies, and the best as far as I see, is integrative health. And we're integrating the best therapy types for our patients based on the evidence. So you're going to have another learning activity in this learning unit that will further define and help you clearly understand the terminology that we're using today. You're also going to be able to discuss factors that healthcare providers need to consider when providing safe and effective complementary health approaches, such as natural products to individuals with chronic illness. And even if we're not providing, our patients come to us telling us of the techniques, whether it's relaxation techniques, what mind-body techniques they're using, what natural products that they're using, along with what pharmaceutical medications that they're on. So it's important, it's essential for nurses to be aware of many of the natural products, such as herbs. So for this learning unit, you're going to read chapter 4 in your Mindful Nurse text. And it's talking about reaping the benefits of mindfulness practice. Then you're going to do a couple of other things. First of all, you're going to go on to the Center for Complementary and Integrative Health. This is an excellent website. It is through the National Institutes of Health, who have organized this center and who fund this center and the research, much of the research that's being done on integrative health. And you have a choice to review one of two topics, either yoga or relaxation techniques. So when you click on, you know you're going to go to the site, and you can, let's just do a quick look at it, and you can either go to the topic on R, which is relaxation techniques, or Y for yoga. Let's get back here. And then you're going to read information that's found also from the National Center for Complementary and Integrative Health on what's in a name. We say complementary, alternative, or integrative health. So this is the readings that you're going to do this week that will really help clarify the different terms that we're using. If you want to print it out, it's going to be about 6 pages. And it's important that you do this reading because Quiz 5 is going to test your comprehension of this information. So please make sure you read prior to taking the quiz. The next thing is a 3-minute breathing space mindfulness meditation. Enjoy. Come back to this as often as you like. Chapter 5, again, is going to include information found in that article, what's in a name, as well as Chapter 4 of your mindfulness textbook. So you're only going to have one attempt to take this quiz, but you have 45 minutes to complete. So relax as you go through this quiz. Number 5, discussion board is going to ask you to summarize the information that you learned about either relaxation techniques or yoga. And don't forget to reply to at least one of your classmates' postings. Now, this week is relatively light in learning activities as far as time-wise. It's important information, but it's not going to take you as much time. And one of the reasons is because your herbal presentation is due at the end of next learning unit. So I want to give you time to work on that. So you can either go to your assignments tab on the left-hand side, or you can click right on here for the herbal presentation. And you're going to find that there's video instructions about completing your herbal presentation. But before you start off, make sure you have already signed up for the herbal supplement that you're going to do your presentation on. There is a wiki. You need to sign up, and only one student can sign up per herb. So it's important for you to do that. Here is more information, grading rubrics about completing. Here is, there's even links. So please make sure you're reading this, because you're going to have to cite 2 journal articles by searching the databases. And you can do that by, this is the link to the library. And another good source that I'd like everybody to use is the National Center for Complementary and Integrative Health that you were on to look at the information for your relaxation techniques or yoga. But it has another section about herbs at a glance, and this will give you some great information. So please make sure you're reading through that. And then there is a folder with instructions about how to do a voice-over presentation, whether you're using PowerPoint or Screencast-O-Matic and the Dropbox. So that is going to be there for you. And while I have just closed out of our Blackboard course site, the last link that you're going to see there is the library resources. And please remember that I have posted under library resources a video about how to search the databases. So if you're just not sure how you're going to go about finding these 2 journal articles on your herb, please take a few minutes to watch that video. It will help you get some really good research articles and get 2 peer-reviewed journal articles. So I hope you have a great week, and as always, please call or email if you have any questions. Take care.